Hi, I'm Stephanie Rivera-Velasquez. The H1 epidemic has all of us paranoid. It is extremely contagious, yet one can avoid contracting it by practicing simple hygiene practices. One may think they are germ-free if they wash their hands. However, one will see that there is specific art in washing one's hands perfectly to get rid of germs and bacteria. I am definitely mythophobic, and I try to take precautions and keep my hands clean as much as I can. One needs to learn how to wash one's hands properly and why it is important to do so. First, I'll talk about why to wash one's hands. Secondly, I'll speak about when to wash one's hands. Finally, I'll discuss how to wash one's hands. There are many reasons as to why one should wash their hands. For one, washing hands often can reduce the risk of spreading the flu and cold viruses. When handling food, this also eliminates the risk of contaminating food, resulting in food poisoning, according to Mayo Clinic. Hand washing kills bacteria related to the restroom. Washing hands prevents illnesses and spreading diseases. According to the CDC, this is key in some professions such as the medical industry, daycare facilities, public places, and in food settings. Washing hands can prevent one from a fatal situation. Now that we have looked at why to wash our hands, I want to inform when one's hands should be washed. There are specific times when one should wash their hands. Giving medicine or treating wounds or before eating are some examples. They all should be washed before handling contact lenses or treating the sick, according to the CDC. You should also wash your hands before handling food. One should also wash their hands after specific activities. These include preparing food, using the bathroom, changing a diaper, or washing one's hands after handling animals or anything that relates to animals. They also should be washed after touching the sick, handling wounds, touching garbage or contaminants, blowing your nose, sneezing, or coughing into one's hands, according to WebMD. After getting to know the whys and whens of hand washing, I will now teach the how-to of washing hands. Washing one's hands is very simple if done properly. One should wash their hands with warm or hot water whenever available. Use soap, preferably antibacterial. Lather the hands and scrub for around 20 seconds or so, making sure to wash underneath the nails. According to WebMD, the next step is to wash the soap off and use a napkin or towel to turn off the faucet to prevent from spreading more bacteria. Hand sanitizers are another option. The steps are very similar. Use hand sanitizers when you have no dirt or grime. Just need to get rid of hands bacteria, according to Mayo Clinic. I will now demonstrate how to do this. You need hand sanitizer that is at least 53% alcohol, which this one happens to be 63. Pump a small amount into your hand, lather and rub, and you rub and rub some more until it is dry. Make sure that beforehand you have no dirt or grime or this will not work. And that's a simple step. Now one has all the knowledge needed about the proper way to washing one's hands and why it is important to know. I talked about why to wash hands, when to wash one's hands, and what is the proper way to wash one's hands. As a mythophobic, I am constantly washing my hands, trying to prevent myself from catching something from someone who didn't wash theirs properly. Hopefully, more people will learn from that.